Hello and welcome again to another talk. I'll be briefly discussing a common condition that is encountered in men called an enlarged prostate gland. So, this will be a brief patient guide to an enlarged prostate gland, and I'll be covering certain topics regarding this. But before I go into it, and just to give you a brief introduction, an enlarged prostate gland is a common health problem among men and is usually an age related problem and common in men over the age of 50 years. One thing that has to be remembered is that enlarged prostate gland does not necessarily mean you have cancer, but the problem with it is that it can cause urinary troubles, and this can be quite problematic for some patients. The primary treatments include medications mostly, though a small number of patients may require surgery. So, this is a brief introduction and probably just a brief summary of what I'm going to discuss. So, in this talk, I'll be covering what is a prostate gland, what is an enlarged prostate gland, what are the causes of an enlarged prostate gland, what are the symptoms of this condition, what tests would you need, is it something to worry about, and what are the treatment options and tips to relieve the symptoms that arise from an enlarged prostate gland. So, talk about what the prostate gland is. It is a walnut sized gland that is present at the base of the bladder. So if you look at the image on the right, you will see that I've highlighted the prostate gland in a red box, and this is seen at the bottom of the bladder. And you can see that the tube that passes through from the bladder passes through the prostate gland into the penis. So this is how urine passes through. So the prostate gland does have some effect over this tube, which is known as the urethra, which allows urine and semen to pass through. Now, in the younger years, during childbearing times, during ejaculation, the prostate contracts and releases a fluid that makes up a part of the semen, and this fluid helps the sperms to swim up quite freely. So, it is quite important to have a normal functioning prostate gland in younger years because it primarily aids reproduction. So, what is an enlarged prostate gland? Well, in simple terms, an enlarged prostate gland basically means that the prostate is larger than normal. The normal prostate gland is, as I said, the size of a walnut and weighs about 20 grams or so. And a prostate that measures and weighs more than this is called an enlarged prostate. The increase in size and weight can be rather dramatic, and sometimes it can be quite problematic, especially when it comes to certain symptoms that patients encounter. An enlarged prostate gland is sometimes called BPH or benign prostatic hypertrophy, which in simple terms means it is completely harmless, the enlargement, but sometimes the prostate can be enlarged from prostate cancer as well. So, what are the causes of an enlarged prostate? Well, the most common reason why the prostate gland enlarges is advancing age. It is common in men over the age of 50, and as they get older, the prostate can get larger. But there is another concern that enlarged prostate gland may be due to prostate cancer because this is the most common type of cancer in men. But if it is caught early, it can be treated quite aggressively and carries a good long-term prognosis. What about the symptoms of an enlarged prostate? So I've already discussed how the prostate is present at the base of the bladder. So just imagine that something is squeezing the base of the bladder and not allowing urine to come out. So this is what happens in an enlarged prostate gland. So the patient experiences difficulty starting urination. So they go to the toilet and they stand there waiting for urine to come out. So this is sometimes what I call starting trouble. And this is what the patients usually describe. When they pass urine, they find that they're passing out a very thin stream of urine compared to what they normally pass. So this seems to be what they feel is a weak flow. The other thing that can happen is dribbling of urine. And another important symptom that they encounter is a feeling of incomplete emptying. So they go to the toilet, they pass urine, but a little bit later they feel like they need to pass urine again because they feel that they've not emptied their bladder out completely. In a small number of patients, they may experience painful urination, but a larger number of patients experience waking up in the night to pass urine. So as we get older, it is quite common for men to pass urine maybe once or twice a night, but those who have prostate problems can pass a lot more than that, may wake up at least 5 to 6 times a night sometimes. And many of them have difficulty controlling urination, and some of them also have frequent urination, like I have mentioned, especially regarding waking up at night, but also during the daytime, they will find that they have to go more frequently. But this is not a very typical sign of enlarged prostate gland. Frequent urination can be seen in urinary infections as well. So it is important to remember this. And this is something that is ruled out when a diagnosis of an enlarged prostate is made. So, what are the tests you would require to determine if you have an enlarged prostate? Well, if you're experiencing any of the symptoms, the first test that you will need is a urine test to rule out a urinary infection, because many a times an infection can mimic the symptoms of an enlarged prostate, and this can be very easily tested and only takes about 20 minutes to get a report. And if you have a urine infection, your doctor will prescribe you some antibiotics, and you may find that your symptoms get a lot better. But if you wish to know if your prostate gland is enlarged, the best test to perform is a ultrasound scan. An ultrasound scan will help determine not only the size of the prostate, but it will also tell you how much urine there is in the bladder and how much urine is left after you have passed urine completely. So this is what we call a post-void residue. Now, normally there will be no more than 10 ml or so, but if there is more than 20% of the urine left behind that was there compared to what was there prior to passing urine, then it indicates that the prostate is causing some trouble with urination. Also, an ultrasound test is very important because it can help determine the status of the rest of the urinary system. This is the kidneys, the ureters, and other structures within the abdomen. So you can also look at the liver and the kidneys and other organs as well. Another test that is very important if you're looking for problems with the prostate gland is a simple blood test called a prostate-specific antigen. Now, this is a test that helps determine whether the enlargement of the prostate is because of age-related changes or because of prostate cancer. Now, this is not a very specific test as such. It is not a 100% sensitive test either. But what you can know with some degree of reassurance is if that your levels are normal or just mildly elevated, it is likely that the PSA elevation is age-related. But if the levels are extremely high, then it could indicate prostate cancer. The confirmatory test to rule out or confirm whether or not someone has prostate cancer is a biopsy. So this is where a tiny needle is inserted into the prostate gland and a piece of tissue is removed and analyzed by a pathologist under a microscope. And this gives a classic appearance and helps rule out a prostate cancer if it is age-related enlargement alone. Now, should I worry about an enlarged prostate gland? Well, not really, because most of the times it is likely to be age-related than due to cancer. And it is also very simple to rule out cancer through blood tests. And many a times if any of the tests show an enlarged prostate, it is quite mandatory to get a prostate-specific antigen test done. It's a simple blood test, takes a few hours for the report. And once that is done, a urologist may perform a rectal examination as well to assess not only the size of the prostate, but also the surface of the prostate to see if it is smooth or irregular. If it is smooth, it is very likely a age-related enlargement. But if it is irregular or nodular, it is possible that the cancer is there in the prostate gland. So what are the treatment options? Well, generally, a lot of men have enlarged prostate glands, and if it is not causing any symptoms, it doesn't require any treatment, but may require an annual ultrasound study to determine if the prostate is enlarging rapidly or slowly. Even some individuals who have very large prostate glands don't require any treatment. I personally have seen a fair few number of patients with a prostate gland over 100 grams, with a normal weighing below 20 grams, and having no symptoms whatsoever. And all we have done is just monitor these patients. So it is not necessary that any specific treatment be given unless they're getting symptoms. But if there are symptoms, there are medicines available that can help ease the pressure that the prostate puts on the urethra and allows the urine to come out a lot easier. Many a times this is the first line of treatment. But if some patients don't respond to this, and if the large prostate gland is blocking the flow of urine and causing what we call urinary retention, then in such a situation, patients require surgical removal of the prostate gland. This is because if the urine gets blocked completely, then the bladder can enlarge and it can be quite a painful condition. And an enlarging bladder can sometimes put back pressure on the kidneys and can cause kidney damage as well. So that is why it is important that if you have a large prostate and you've experienced even one episode of urinary obstruction or a blocked urinary bladder, in such a situation, it is better to take out the prostate gland completely. These days, it is done through laser surgery. The procedure is called a transurethral resection of prostate, or a TURP procedure. It is one of the most common procedures that is performed by urologists these days and is very safe and has no real side effects as such. Of course, speak to your urologist about any potential complications before you undergo the procedure. Now, if you do have symptoms of prostate enlargement, so urinary frequency, urgency, etc., then just take note that stress can sometimes increase urinary frequency if you have an enlarged prostate. So, taking up measures such as yoga and meditation can help reduce stress levels. The next thing that you can do to relieve symptoms is to take your time in the bathroom. Sometimes, when you're wanting to start passing urine, it can be quite difficult. And the bladder also does not empty completely. So, make sure you take time. There is no need to rush. Another thing that you could do is avoid drinking water late in the night. Now, the more water you drink, the more urine you produce, and the more likely you're going to wake up to go to the toilet. So, a lot of times I tell my patients to stop drinking any water after they've had their meal in the night. And then this will hopefully, to some extent at least, bring down their frequency of having to go to the bathroom. And finally, some of the over-the-counter medications can worsen symptoms. So, always speak to your doctor and find out if any medicines are worsening your symptoms. Just note that an enlarged prostate gland does not turn into cancer. An age-related enlargement does not mean that somebody is at risk of getting cancer, but it is important to get yourself checked out. Furthermore, having an enlarged prostate gland doesn't affect your chances of fathering children either. So, to summarize, an enlarged prostate gland is a very common problem in men. It causes very troublesome symptoms, but it is easy to find out if you have an enlarged prostate gland through a simple examination and an ultrasound study, and treatment options are plenty and effective. Well, I hope you enjoyed this video and found it useful. Please do leave your comments and suggestions in the comment section below, and subscribe to this channel if you wish to learn more about other health related problems, which I shall post as and when I can. Thank you very much.